Good morning. I am Dr. Borgarkar and I am at the Bifurcation Club of India meeting in Mumbai. And today morning I am in conversation with Dr.A.Mathavan, who is Director of Cardiology Department, Velammal Medical College, formerly Senior Consultant at the Apollo Hospital Group. Dr. Madhavan is a pioneer in interventional cardiology in Tamil Nadu. He is involved in major clinical trials. He is a fellow of the ACC, ESC and the SCAI. So good morning, Dr. Madhavan, and welcome to this meeting.
Good morning, sir.
So let's begin with the importance of how cholesterol affects patients with heart attacks.
Cholesterol is one of the few risk factors of coronary heart disease, that is a heart attack and stroke and kidney failure or blockage in the legs, peripheral arteries. So it all came in the year 1960s because of the Birmingham heart studies. They found that high cholesterol content causes all these problems. So it's very important.
And obviously, cholesterol is not the only risk factor. So could you elaborate on what are the various risk factors which are important, especially for patients at risk of heart attacks?
There are several risk factors. As you know, our own friend Dr. Salim Yusuf from McMaster University, Canada, he has studied a major trial called Interheart study, where he had studied patients who are at risk for heart attacks. That is diabetes, high blood pressure, smoking, obesity, high cholesterol, and lack of eating fruits and vegetables, stress, and so on. So there are so many important components of risk factors which affects a person, leading to heart attack, stroke, and kidney diseases. And the combination of any 2 or 3 is not arithmetic. Suppose a diabetic has 2, hypertension has 2 risk factor, it is not 4, it is something like 16 or 30. It is not arithmetic, it is multifold. So if you have combination of many risk factors, the chance of getting heart attack and other serious illnesses, as I have mentioned earlier, are very, very high.
So only cholesterol is not the risk factor that we need to be worried about. There are so many other risk factors, including high blood pressure and diabetes and other stressful situations in life. So let's talk about cholesterol in particular. Why is cholesterol so bad for your patients?
Because in cholesterol you have a good cholesterol and bad cholesterol. As we all know that bad cholesterol, which is called LDL, low density lipoprotein cholesterol, is very bad, which actually has got a strong evidence to suggest causes acute coronary syndrome, that is heart attack and stroke. There is something happens in the blood vessels, where the accumulation of the LDL causes some plaques in the blood vessels of any blood vessels, including heart blood vessels. So once a plaque ruptures, it activates many blood cells and causes a clot. That's the whole thing. So the idea is to cut down the LDL cholesterol, which is a bad cholesterol. And the evidence has proven that lowering the LDL cholesterol has got the better outcomes.
Right. So what Dr. Madhavan is suggesting is this LDL cholesterol enters into the walls of the arteries, especially the heart arteries, and is one of the major factors which is responsible for heart attacks. But before we go into the heart attacks, could you tell us about where does this cholesterol come from? Is it from the diet, or are there other sources for this cholesterol?
There are 2 types of cholesterol. One is cholesterol, that is what we measure total cholesterol, and is triglycerides. The triglycerides come from food. What we eat is actually converted into energy. If it is not converted into energy, it accumulates as a fat. But cholesterol is synthesized in the body. It is mainly useful for formation of enzymes and hormones. So cholesterol is synthesized in the body, triglycerides is from what we eat. If we eat excess and it is not utilized properly, it accumulates in the body. So both are important. Cholesterol is important and triglycerides are also important.
So the triglycerides come from the food, cholesterol is synthesized within the body, and we've been hearing a lot about trans fats in the food. So could you tell us something about what is the importance of trans fats and why are these not so good for the heart?
Trans fats are nothing but saturated fats. You know there is a saturated fat which is bad for blood vessels, and unsaturated fats. There are two types: polyunsaturated, monounsaturated. But what happens is when you use oil repeatedly, as we have seen in the hotels and even roadside hotels, we used to fry items like bhaji, vada, all these things repeatedly in the same oil. The oil gets one more addition of hydrogen, which makes them trans fats. These trans fats are again a saturated fat, which is very bad for the heart.
So what you're saying is you avoid these food items which are repeatedly fried in the same oil because that increases the trans fats. That's a very good idea.